Heart disease is the #1 cause of death in the world, and in 2016 there were 240,000 deaths in Egypt from heart disease. In 2020 there was around 2.3 million babies born in Egypt, and around 20,000 of those had congenital heart disease. Of those 20,000 born with congenital heart disease, the total number of children that get surgical or catheter repair in all Egyptian hospitals is around 46,000. Sadly, most of those who do not get intervention will die. If you look at Africa as a whole, with the high fertility rate, there is almost 2 million children born with congenital heart defects every year. And due to poor access of healthcare, sadly, most of them die due to lack of service. And this is what urged us to form Aswan Heart Center. And I will leave Professor Yacoub to tell you about our mission.
The AHC should be a center of excellence to serve neglected population who have nothing else to go to, but also to offer these services at the very highest level, free of charge, regardless of who they are, their color, creed, or whatever. And we concentrate mainly on the very poor and desolate patients who happen to have very complex heart disease of any type. All the people working here are handpicked, and they chose themselves as well because they identify with what goes on. And what goes on is a commitment, and the commitment is not 9 to 5. If it is 3 a.m., we're going to be here at 3 a.m. It's also teamwork. We also have a culture of respecting the patient. Whoever he is, most of our patients are desolate. They really are suffering, they're poor. So the last thing you want to do is to treat them badly. The commitment is also to treat the patient as a human being at the highest level. And that is part of the culture, part of the commitment, part of the hospital, part of AHC. We have to do it. We love to do it. The research program is wide-based. It is integrated with the service, so you have that from bench to bedside and from bedside to bench all the time. So the information in the lab becomes handy for the patient. So research we think of as a necessity. It is not a luxury.
In the 80s, Professor Yacoub started medical missions in support of the underprivileged patients around the world, with special interest in Africa and Egypt in particular. In 2009, we started Aswan Heart Center Phase 1. In 2011, we expanded to Phase 2, and in 2014, we completed the Aswan Heart Center project by Phase 3. We now started construction of the new Magdi Yacoub Global Heart Center, Cairo, to open its doors in 2023. So as we expanded our HC facilities through the different phases, we matched that with growing our workforce. This gradually increased our capacity, not only in numbers, but in complexity as well, while maintaining quality. As of 2020, we have seen more than 200,000 patients in the outpatient clinic and performed more than 22,000 procedures.
هي مليكة قبل العملية طبعا كانت حاجة، وبعد العملية بشهر ونص بقت حاجة تانية. أحسن بكتير من الأول طبعا، يعني بقت طبيعية الحمد لله. يعني كان الموضوع فيه اهتمام عالي قوي، كان فيه سيستم وتنظيم، وده اللي يمكن يعني لو قالوا لك اقعد 5-6 أيام ما تشوفش بنتك كنت هتسكت، بسبب اللي انت عارف انت مش هتعمل حاجة، يعني انت مش هتشوفها، بس انت عارف ان كل حاجة ماشية صح، كل حاجة ماشية مظبوط.
In 2009, when we started AHC, we depended on the Treat and Teach program, where visiting international teams worked with and also trained our local team. A hand-picked few of our local team also traveled to international centers for more in-depth training. These are some of the centers we worked with, mainly from the USA, Canada, and Europe. Over the years, we developed our own in-house local trainers. The local trainers are the core of our in-house incubator program that secures a sustainable growth in our workforce. And through the futuristic leadership and agile modern governance, we were able to balance our growth and gradually and simultaneously scale up our facilities, workforce, and financial resources. You were able and privileged to put a good fight for the lives of these babies and bring a smile back to their families. And as Professor Yacoub mentioned, research is an integral part of our project. It is an integrated, innovative program of both population studies and disease-based projects. This is a list of our 2020 publications. We usually publish around 20 to 30 publications in peer-reviewed journals every year. Passing on knowledge to others is an important part of our project. More than 1,000 trainees and fellows from Egypt and Africa go through our fellowship and workshop programs every year. These are snapshots from our workshops. Most of our trainees and fellows come from Egypt and Africa, but we do get a few from Europe, USA, Canada, and even all the way to Haiti. Professor Magdi is chairman of the Magdi Yacoub Global Heart Foundation USA and also COO of the Magdi Yacoub Foundation Egypt, will now give you an introduction to the new project Magdi Yacoub Global Heart Center Cairo.
We were faced with demand which was really 3 to 4 folds of what we do every year. So to meet the demand which exists in Egypt, we needed to expand. McKinsey, gratis, without any cost, have done a study which took about 5 months, and they came up with the same conclusion. Yes, you need a center which will be able to meet this huge demand which exists in Egypt. And if you're trying to help with Africa, that it becomes a must. We believe with that size of hospital, we will be able to do 4,000 surgical procedures a year and about 9,000 to 10,000 intervention, either adult or pediatric. What makes the new center unique is not just a hospital where we will treat 12,000 or 14,000. No, it's just we're creating a new generation. It is very important because this is about the sustainability all over the place. Sustainability. If you create good cardiac surgeon, he will be going back to his country in Africa or in the Middle East, and he practicing the same ethos, the same vision, the same inspiration of what Magdi Yacoub is all about.
We come with a group from Aswan Heart Center to perform operations and catheter interventions for very needy patients with heart disease, and also to train local staff so we can have a sustainable effort to help eradicate or alleviate the suffering. The amount of work which needs to be done is massive.
Now, we came this mission with 3 purposes in mind. The first one is to help the patients with heart disease. The second one is training of the local staff. And the third purpose is strengthening ties in terms of research and scientific innovation.
This continued process of learning, exchange of knowledge is what effectively translates into better patient care.
We were able to treat a larger number of patients, but also a lot more complex cases.
We can eradicate these diseases and bring happiness, good health, and smiles without the collaboration and the support of people. There will be nothing.
أنا محمود جمال، مريض قلب عند الدكتور مجدي يعقوب. أنا عايش بقلب صناعي أو جهاز الليفات، هو ليه كذا مسمى. أنا قبل العملية ما كنتش بقدر أقوم من على السرير، كان في ألم شديد في القلب. ده بسبب إن كفاءة قلبي كانت حوالي 10%، وما كنتش عارف أمارس حياتي بشكل طبيعي خالص، أو ما كنتش قادر أتحرك أصلا. الدكاترة كلموني قالوا لي إن في الجهاز اللي هو الليفات أو القلب الصناعي ده ما بيتركبش في اي مكان في الشرق الاوسط غير عند مركز الدكتور مجدي يعقوب. انا الاول اترددت، كنت خايف من الجهاز ان هو عقب حياتي، بس بعد ما عملت العمليه اتحسنت كتير، بقيت بنزل جيم، بقيت بجري، بقيت بروح شغلي.
قلبي ومفتاحه دول ملك ايديك، ومساء وصباحه بيسألني عليك. قلبي بيقوى وانت معايا، وفي وجعي وجودك ده دوايا، ما هو انت بعيد برضو حبيبي.
انا عايز اشكر الدكتور مجدي يعقوب ان هو عمل المركز بالامكانيات دي والروح دي والانسانيه اللي موجوده في المركز ده، مش موجود في اي مكان تاني. المركز فعلا على اعلى مستوى، وانا بشكر فريق الاطباء وفريق التمريض اللي هم عملوه معايا وتعاملهم يعني بالانسانيه والروح والكفاءه دي، مش معايا بس، ده مع كل المرضى كده.